Now we'll move to pulmonary stenosis. Pulmonary stenosis. So this pulmonary stenosis is just like we're trying to say there's like an issue in the pulmonary valve. Okay, so there's an issue in the pulmonary valve. So the pulmonary valve is not relaxing, okay, so that blood will pass. It's not closing so that it will prevent blood flowing back. Okay, so the normal activities of the pulmonary valve are being affected. So the pulmonary valve stenosis, we say that is a heart valve disorder where the pulmonary valve, which controls blood flow from the right ventricle into the lungs, because deoxygenated blood moves from here right into the lungs like this. So is a valve that is actually controlling the movement of this blood, so that blood is moving smoothly on a one-way tract. The one-way tract I'm talking about is the blood is moving one direction. As blood is flowing into the pulmonary trunk, it shouldn't flow back. Okay, so the valve can be narrowed or obstructed, making it very hard for blood to reach the lungs for oxygenation. Do you understand? So what we are having here is types of pulmonary stenosis. It could be valvular. This one is a valve leaflet. It could be subvalvular. This one is below the valve. It could be supravalvular. This one is like above, like the issue is happening above, like above the valve. Okay, so causes, it could be congenital, where the person is just born like that. So it's linked to syndromes like the Noonan syndrome, Williams-Billings syndrome, Tetralogy of Fallot. Then it could be acquired, like there are some 1 or 2 infections that actually led to development of the defects. Then symptoms, like what would the child be feeling? So mild to moderate. Mild cases are just no symptoms, while moderate ones, they're having difficulties in breathing, chest pains and palpitation, fainting spells, sinuses where the skin is now becoming very bluish, then crescendo decrescendo systolic murmur, okay, heard at the left upper sternal border. So diagnosis is, if I want to actually confirm that there's an issue in the pulmonary valve, of course the valve is buried deep down, so I'll do images like electrocardiography. No, so that's not an image. That's not. Yeah, the electrocardiogram is basically for electrical activities. Then chest X-rays, cardiac catheterization. Treatment, if it is mild, I just observe. If it is going crazy, I do balloon valvuloplasty. So I'm trying to actually replace this valve, okay, with an artificial made valve, so that blood flow can continue there. Okay, so then surgical valve repair or replacement for complex cases.